that the spike protein was lethal. And to give a genetic code for a potentially lethal protein that was devised in a Chinese biosecurity lab to Americans was the most dangerous proposition our government agencies could have ever put forward to our country. And what we've learned on this is extraordinary. Castriuta and colleagues has published the messenger RNA is physically circulating in the blood for at least 28 days. That's as long as they've looked. Crossan and colleagues from Harvard has shown the messenger RNA is stuck in the human heart 30 days after the vaccine when people die. And there's inflammation around it, presumably due to the spike protein. Röntgen and colleagues from Stanford have shown the messenger RNA is stuck in human lymph nodes for at least 2 months. And that's as long as they've looked. Now, the spike protein, which is produced by the messenger RNA, is widely circulatory in blood and shown by Harvard, by Ogata and colleagues, Swank, and recently Brogna in Germany. Now, Brogna in Germany looked 6 months afterwards, and at least half the people who took the shots had vaccine spike protein circulating in their bloodstream. That's as long as they've looked. And they can identify it because Pfizer and Moderna have an amino acid signature on their spike protein to let us identify. We know that it's Pfizer and Moderna. It doesn't come from the natural virus. It's coming from the vaccine. That's proven. The spike protein now, in 3,400 peer-reviewed papers and growing, is proven to cause heart damage and myocarditis. Our regulatory agencies agree. Every regulatory agency in the world agrees. There's actually guidelines now in the UK and Australia about how to diagnose and manage vaccine myocarditis. That's how common this is. It accelerates atherosclerotic cardiovascular disease, causes tremendous swings in blood pressure and heart rate called posterior orthostatic tachycardia syndrome or POTS, causes neurologic injury, stroke, both ischemic and hemorrhagic, paralyzing syndromes, including Guillain-Barré syndrome, small fiber neuropathy, ear ringing. It causes blood clots. The spike protein is physically found in blood clots. The largest blood clots that we've ever seen in clinical medicine, typically a blood clot that someone would get after a hip surgery or on an airplane would be a centimeter or so. It's common in my practice. Yesterday, I saw patients with 15, 17, 2 feet blood clots in their legs. Oh my God. After the vaccine. We see blood clots both on the arterial side and on the venous side. This is distinctly unusual. The body is set up after the vaccine to form blood clots. And this is particularly harmful in people with a predilection to blood clots or other provocateurs, hip surgery, smoking, supplemental estrogens, prolonged immobility, etc. It was known that